All right, my study is over the effects of high intensity interval training versus continuous training on the cardiovascular disease in the older population. So a couple key terms, cardiovascular disease, CVD, is a group of heart conditions that include heart and blood vessel disorders such as heart attack, stroke, and heart failure. It impacts about 71.3 million adults. It is the leading cause of death in the United States, with about 655,000 each year. It's most common in older adults, ages 60 and up, and many of the factors are being overweight, family background, and inactivity. So a heart attack occurs when the flow of blood to the heart is blocked. The blockage is mostly often a buildup of fat or cholesterol. Stroke occurs when the blood supply to parts of the brain is interrupted or reduced. This prevents the brain to get the oxygen and nutrients that it needs. And heart failure occurs when the heart does not pump blood like it should. No arteries in your heart or high blood pressure. Leave your heart too weak or stiff to fill and pump like it should. So a couple terms that I used in my study, high intensity interval training, HIIT, is short periods of intense anaerobic exercises with less intense recovery periods. Continuous training is physical training that involves activities without rest. And max heart rate is the maximum number of beats made by your heart in 1 minute of effort. In this graph, this chart shows that that BMI, or body fat percentage, the higher it is, the greater risk of developing CVD. You can tell from the normal, and then it goes to the overweight, overweight, and then obese. The CVD deaths actually increase. These diagrams show, well, the first one shows BMI again. The red and darker red areas are the highest areas, or the areas with the highest BMI. The middle one is a chart of leisure activity. The blue and dark blue areas is the less leisure activity areas. And the third one is the cardiovascular disease death rates. The maroon and dark areas have the greatest death rates. And if you can tell, CVD is impacted by the less activity areas and the higher BMI. So a couple of studies. In this first study, they compared high intensity HIIT workouts versus continuous training for 8 weeks. The interval training group performed 3 sessions of 12 repetitions for 30 seconds of exercise, and then followed that by 60 seconds of complete rest. The continuous exercise group consists of 45 minutes of aerobic exercises. And they found that the interval training group increased significantly their VO2 peaks, the duration of exercise tests, the oxygen plus oxygen consumption, and distance walked. The continuous training group increased the time at the threshold and the distance performed. This study also showed that the interval training at very high intensity for patients with heart failure appeared to be more effective than continuous training and improving submaximal exercise capacity. And the chart on the side shows the threshold where lactate begins to accumulate in the blood. Can be identified at the point where the breathing rate begins to increase. We can tell that in the interval training, it increased the most. In the next study, they compared the effects of resistant training, high intensity aerobic interval training, and moderate continuous aerobic training on cognitive and physical function of healthy older adults. So the resistant training group performed upper and lower body resistant exercises using machines and free weights. It was 3 sets of 10 at 50, 75, and 100% of the individual's 10 repetition max. After 8 weeks, they increased the load to 75%, 85%, and 100% of the individual's 10 rep max. The moderate continuous aerobic training performed continuous walking on the treadmill at 70 and 75% of maximal heart rate for 47 minutes, and the HIIT group performed intervals of 4-minute treadmill walking at 90 to 95%. And had 3 minutes of recovery period at 70% of heart rate max. The speed of the treadmill was constantly adjusted to ensure that they were hitting their max or the heart rate range that they were trying to hit for the activity. Moderate continuous training and the resistant training actually provided to be superior to HIIT in enhancing older individuals' cognitive function. However, the HIIT were most beneficial for improving in information processing speed. HIIT also included large gains in physical function, which is very good for the heart to keep the blood pumping and so on. The next study, they aimed to evaluate the progression of vascular and cardiac changes over a 6-week training period. It was 12 healthy men participated in high interval training, consisting of 1-minute sprints and then 2 minutes active recovery, 3 days a week for 6 weeks. Cardiac, vascular, blood lipids, and CO2 max measurement were taken at 0 at the beginning of it, 3 weeks into it, and 6 weeks, and compared again against against a controlled group. The 6 weeks of high intensity training increases the aerobic fitness and is enough to stimulate reduction in pressure, but it wasn't significant in cardiac changes, reducing stiffness in the arteries or lower CV risk. In the last study, they assessed the effects of combined upper and lower body HIIT on fitness in adults aged 50 years. So it was 36 adults, 50 to 81 years. It was either a HIIT or a non-exercise control group, following a baseline assessment of leg extension, muscle power, hand grip strength, cardiorespiratory fitness, and health-related qualities of life. The HIIT group completed 2 training sessions per week for 12 weeks, performing a combination of upper, lower, and full body exercises. So in the combined upper and lower, HIIT had beneficial effects on muscular and cardiorespiratory fitness in older adults. So this graph is from the last study. It shows that, again, the HIIT had a possible small beneficial effects of general health, mental health, a small beneficial effect on body pain compared to the control group that they compared it to. So for my study, the purpose statement is to determine the effects of high intensity interval training versus continued training on cardiovascular disease in the older population. So the design of my study is to be a randomized controlled trial, and the individuals will be split up into a HIT group or continuous training group on cardiovascular disease. It'll be 6 months, and we're going to, which will determine which is most significant, has the most significant impact. So the participants are going to be over the age of 60, inactive men and women who have CDV, have cardiovascular disease, and they'll be recruited from the Dallas area. The goal is to have 30 men and 30 women, again, with some sort of cardiovascular disease, heart attack, heart failure, or stroke, things like that. So participants must have no previous exercise experience, haven't smoked in the past 6 months, won't have any procedures in the future, not on any ventilators, or have heart implants, anything like that. All participants must provide a weekly activity log, just so that we know that they're not doing more activities outside of the exercise, nothing over 70% of their maximal heart rate for 25 minutes. And they will not be able to consume alcohol, more than 2 alcoholic drinks the night before the workout, just so that they don't come in and be real tired or anything like that. So the procedures, the first week is going to be familiar, to get them to be familiar with the workouts. During this time, they'll be tested for their maximal heart rate. So for the HIT workout, they're going to walk for 3 minutes on the treadmill at 87 to 92% of their maximal heart rate, and then walk for 4 minutes at 67 to 72%. So roughly about 45-minute training session. We're going to do this 6 times, which equals about a 45-minute training session. And I got that from the previous studies. Let's see. The second previous study, I took that from. I also, each group will be wearing heart monitors to keep them in that target heart rate range. So if they fall below the range, the continuous training group will walk a treadmill for 45 minutes to 67 to 72% of their maximal heart rate. The goal is to have HIT at the 90 and the continuous training at 70, but I'm going to give a little, because of course there'll be times where it'll fall under or go higher. So we'll also be wearing the heart monitors for people, and if they fall below, we'll adjust the treadmill to go higher or increase the elevation and increase the speed to meet that target heart rate. And I think that's it. Any question, concerns? Again, this is just to cardiovascular disease is really big. Obviously, it's the highest. It has the highest death rate in the United States in the older population. And this would be good to look at how to maybe minimize the cardiovascular disease and help reduce risk in the older population, and maybe to help the younger generations to see the impact that exercise has on it, eating healthy, and it doesn't even have to be that long of exercise periods, maybe 20, 30 minutes a day for 3 days a week. And should help everyone lower their risk of developing CVD.